Hi, I'm Mackenzie Pyatt. I'm here with Kevin Gillespie, who heads up a growing family of health and community development enterprises, including integrated services for behavioral health. We'll talk about some of the changes we're all starting to notice related to healthcare reform. The idea is to do a better job of helping people to help themselves. As part of our Healthy People, Strong Community series, I'm going to talk with Kevin about healthcare transformation. So Kevin, why don't you tell us what policymakers and planners mean when they say healthcare transformation?
Well, Mackenzie, unlike some of the other things that we've talked about in the series, healthcare transformation is a word that's used and known among people who are sort of inside healthcare policy people and people from health plans and health systems. But I don't really think that regular citizens are that familiar with these concepts. So I'll give it a try to reduce. It's about the idea of healthcare reform. I mean, there are technical issues like moving away from fee-for-service, where you get paid for doing procedures and laboratory billing for things that you do in the healthcare system, toward more in the direction of being paid per member per month to promote health in primary care. But let me make so that's an example of healthcare transformation. But here in Ohio, the Governor's Office of Health Transformation is leading up a broad policy initiative, to move away from the old way of doing healthcare business to a new way of doing healthcare business. Some of the features of that change would be encouraging personal responsibility, which is a theme that we talk about in so many different ways in this series of Healthy People, Strong Communities. It's acknowledging that treatment is important, and especially if you have an acute condition that requires a surgical procedure. But the truth is, most of our health outcomes are related to chronic conditions like obesity on the physical health side, which closely relates to diabetes, or on the mental health side, depression or substance use issues. So a switch away from acute treatment to more of a focus on helping people to help themselves be more healthy. A move away from more casual scrutiny of health outcomes to evidence-based practices and transparent data evaluation, having measures of whether the healthcare supports and practices we put in place are actually effective. A movement away from specialty care, more of an emphasis on primary care. Again, as I mentioned, a movement toward more of a focus on chronic disease states, more of an emphasis on things like diabetes and obesity, and behavioral health toward depression, and seeing substance use disorders more of a chronic lifelong condition and not an acute health issue. So that's sort of the policy side of healthcare transformation, things like that. It's by no means inclusive list, but that kind of gives you a flavor.
So in some more simple terms, what are the main goals for transformation?
Well, much like the term healthcare transformation, anybody who works in healthcare at a policy level, or if you work for a health plan or a health system, everybody by now has heard about the triple aims. And so there are three simple aims for healthcare reform or healthcare transformation, and they all work together if we're going to be successful. One is the experience of care. That is to say, people, when they go to a physician, should have a good quality, relationship-based, feel-good experience of care as reported by the patient. So we want the experience of care to be more humane and feel better. Whereas the criticism of the current system is that it's cold, the pace is too fast. It's an assembly line type experience. Well, we want that to be a better experience. Patient satisfaction, really. We want to include again, there's only 3. It's triple aims, and they all work together. So the first one is patient satisfaction. The second one is population health. We begin to shift away toward an acute focus on individual outcomes toward the health of the entire population. And that would be a big change. And the final one, and in some ways the central focus, though it is one of 3 equal triple aims, is to begin to bend the cost curve down of healthcare in America. Among the developed nations of the world, we have among the highest cost, and we have unfortunately, some of the poorest outcomes. So the goals, the triple aims of health transformation, is to improve patient satisfaction, improve the health status of the entire population, and begin to bend the cost down all at the same time.
So is there a special role for integrated services here?
Well, I would like to think so. So we very much support this process of healthcare transformation. A lot of the on-the-ground work and focused work that we do is integrating behavioral health with primary care under the model of patient-centered medical homes, where you come for your whole person health and you get your behavioral health needs and your physical health needs taken care of one integrated team in one visit. But then also, as you'll recall, we're working on community development, stable food sources, healthy food sources, affordable housing, and the like. So we're very much about healthcare transformation and integrated services.
So what kind of changes can people expect?
Well, again, our focus, and we're working on pilots that raise the bar pretty high. I would expect, let me just talk about primary care. I mean, I'd like to think that people can expect safe, affordable housing, but that's a broad goal and hard to achieve. But where we have a partnership with a formerly more narrow-focused primary care provider, where you went if you've got, a cold or pneumonia, to get your respiratory symptoms treated. Well, if you're having problems over the course of your life with substance use, or if you're having problems with depression, so that you go to one provider, you get a more personal, relationship-based interaction with a team of primary care professionals, and you have the opportunity to interact with not only your primary care physician, but maybe a behavioral health practitioner who can help you with your behavioral health issues, health-related issues, as a whole person, with strong connectivity to community resources as well. In that, one of the things we're working on the patient satisfaction side, is to slow down the feel of visiting your primary care doctor. There are a lot of financial pressures to keep the pace up and to go fast, but we're hoping that we can work as a team to make the experience of visiting your doctor kind of slower, more relaxed, and more personal. Kind of like in the old days when I was a kid, when the doctor was part of the community, part of the family, and everything was just more personal,
Yeah, that makes sense. Well, that all seems really interesting. Thank you so much for taking the time to share this information with us today. If you'd like to learn more about healthcare transformation, you can visit integratedservice.org. Thanks for watching.